Hello, I'm Alan Vyers, founder and CEO of Videntity Systems Inc. And today I'm going to talk about what Videntity is and more specifically how it can be used to build healthcare applications. Videntity is a platform for building new applications or adding features to existing software, and it's designed with healthcare in mind. If your organization has a need for communicating with the public, obtaining patient sign-off, gathering information from your patients, then Videntity might be an ideal solution for your organization. Videntity handles identity verification, communication, and information gathering in numerous ways. The telephone is an almost ubiquitous and sometimes the only communication channel available for many people. In the following examples, I'll show how Videntity harnesses the power of the telephone and performs the heavy lifting around making calls and providing secure, audible communications. Example 1. Using Videntity to power an application for home health monitoring of chronic diseases such as congestive heart failure, diabetes, pulmonary disease, and others. Let's consider the following typical patient-provider relationship. On the left is Rachel Smith. She's 81, doesn't use a computer or email. She's been diagnosed with congestive heart failure. She wants to be home, happy, and independent, and still wants to stay in contact with her physician to keep track of her condition. On the right, we have Dr. Eric Hake. He's Rachel's cardiologist. He's 45 and thinks many health IT systems are difficult to use. He also wants Rachel to be home and independent and managing her own chronic condition as much as possible. Something to point out with Rachel's condition, congestive heart failure, is that it is a condition where even slight weight fluctuations can be life-threatening, so it's crucial to monitor the weight very closely. So it warrants the kind of solution that we're going to be discussing. Dr. Hake uses a Videntity-powered application to set up home monitoring inquiries and to set up an ongoing patient monitoring schedule. In this case, Rachel will hear a message something like, "Hello, this is Dr. Hake. Please enter your weight using the keypad on your phone now. Thank you. Have a nice day." Rachel can also call in prior to Videntity's scheduled contact call, so she'll only be called if she forgets. You might ask, how does Rachel know that this is a legitimate call? Videntity provides patent-pending technology around this problem. The call begins with a passphrase recorded by Rachel in her own voice, establishing the authenticity of the call. You might also ask, how do we know we are actually talking to Rachel? Depending on the situation, Videntity supports several ways to verify Rachel's identity, from voice recognition, a simple PIN, or to just a simple ID confirmation. For example, in this situation, we may say something like, "Are we speaking with Rachel Smith?" Videntity establishes a two-way trusted communication channel over the phone. Then we can perform the transaction at hand. In this case, we're getting a weight reading. After Rachel responds, the results are sent back to the Videntity-powered application and/or to Dr. Hake. Example 2. Using Videntity for the secure exchange of personal health information. Physicians often need to exchange medical information. Videntity provides a consistent, secure way to exchange information between providers. It is becoming more common to involve the patient with information exchange. But what if Rachel was unable to make such a decision because she was unavailable or incapacitated? Can her husband, Harvey, handle the transaction? This is already a lot of communication channel. And this is a simple example with only one family member and two physicians. And this brings up some pretty good questions. Will patient or relative sign-off for record exchange become a legal requirement in the United States? Can the exchange be secure for everyone involved and still not require Rachel or Harvey to use a conventional computer? Can we automatically roll over sign-off rights to Harvey if Rachel is unavailable or incapacitated? Can we create a strong audit trail and record of all information exchange? We believe that patient consent for information exchange will become law in most instances within the next few years. Videntity supports direct provider-to-provider exchange, provider-to-patient exchange, as well as provider-to-provider with patient sign-off exchange models. Videntity is designed to work with people who never use the internet. Videntity is designed to allow one party to sign for another, a sort of limited power of attorney capability. This enables Harvey to sign on behalf of Rachel. Videntity provides a strong audit trail of all communication, even if no sign-off is required, and even if the information is paper-based. Videntity handles paper-based personal health information exchanges using a fax service. Example 3. Using Videntity for adding security to websites. Videntity can be used to add security to healthcare software, patient portals, and any computer resource where additional security is needed or desired. Let's go back to our example with Dr. Hake and try to put ourselves in his position, shall we? I like having web-based access to our health information system, but I worry about security. What if someone steals my password? How can I have a secure system for my staff and myself while keeping others out? If I don't properly protect my patient's information, I not only run the risk of huge federal fines, I also risk losing my patient's trust. Many of my patients are asking for online access to their personal health information. How can we securely provide these emerging services? A Videntity-powered website can be configured to require out-of-band authentication. Typically, a telephone or a mobile phone is used for access control of this type. Users enter their account number and are sent a one-time use code via text message, or it's spoken to them over the phone. Alternatively, Videntity can use voice recognition to verify users. Regardless of the method used, no one can access your account without having access to your phone. This is essentially replacing key fob technologies like what's offered with RSA. Videntity is integrated into Dr. Hake's existing healthcare system or can serve as a framework for new systems, providing strong, easy-to-use security and communication technology. The bottom line, Videntity promotes greater patient communication and involvement in their own healthcare, which contributes to better patient care and improved outcomes. Videntity reduces healthcare costs by streamlining information exchange and automating patient communication. Videntity further reduces healthcare costs by decreasing the necessity of home healthcare visits. Research also indicates automated home health monitoring systems reduce hospitalizations and the length of hospital stays. Patients are empowered to maintain independence while still having state-of-the-art healthcare. Customers can enjoy peace of mind, reduce security risk, and reduce liability concerned with the handling of personal health information. I hope this screencast has been informative on how Videntity can help your organization increase patient communication, patient safety, and improve outcomes while reducing costs and helping your organization comply with security regulations such as HIPAA. Thanks for listening. To find out more, visit us at videntity.com. Have a great day.